Welcome to Season 2 of Moving with CHD, the podcast and blog where I talk to fellow CHD'ers about being active with a congenital heart defect. For those new listeners, I'm Hayley and I was born with atrial ventricular septal defect and had 2 open heart surgeries by the age of 1. I've always loved being active, but growing up I wanted to meet others to get a better understanding of the benefits and limitations faced when exercising with a heart defect. Over these next 6 episodes, we'll share a whole range of incredible stories and the realities of moving with CHD. However active you're able to be, I hope you find some inspiration, encouragement, and the movement you love. Hi Angela, thank you so much for joining us in Season 2 of the podcast. It's great to have you.
Thanks so much for having me, Hayley.
Welcome. I'm really excited for our conversation today because I think you were actually one of the first people I followed on Instagram when I started my page.
Oh, I didn't know that. That's exciting.
Yeah, I found you and I was like, oh my gosh, this lady looks amazing. So I'm really excited for our conversation because we've got a bit of a different perspective, which I'm excited to bring. So I guess let's sort of deep dive into that and tell us a little bit about your sort of background and a little bit about you to start with.
Okay, cool. So I'm a cardiac nurse by background. So I've always been in the heart industry. Ever since I started my nursing training, which was back in Australia in 2006 or 7, I can't even remember now, it seems so long ago. So I worked in the heart ward in Australia, did all my training and then got a job there. And then when I moved to the UK, I also started working on the heart ward at the Royal Brompton, which is quite a big London hospital for hearts. But at the same time, because I was only in the UK for 2 years, even though it ended up being much longer, I did a bit of personal training on the side, just to help, have some flexibility and a different sort of job while I was here. And then the perfect job came up where it combined the two. So it was doing cardiac rehab for heart patients. And I was like, oh my God, why have I never thought of that as a career? Because I love exercise and I love the heart. And then, when I had my babies, I didn't want to commute to London quite so much because I lived about an hour and a half away. So I set it up for myself. So now I do private cardiac rehab for people. And ever since the pandemic, I now do a lot more on Zoom and like Zoom classes, which is really nice because it means that I can reach people all over the world who perhaps, have lost their confidence to get back to exercise. So, I'm really passionate about helping people who aren't currently exercising, helping them get their confidence back, or people who just want that sort of extra knowledge to move forward.
Amazing. And what sort of first got you interested in the cardiac side?
So I guess my big why I went into cardiac nursing was my grandma. So my grandma was like classic when she got to she must have been about 60 and she fell unwell with quite a range of heart things. And at the time I didn't really understand. There was just a lot of pills. I remember her being on warfarin and she had like an overdose of warfarin and her INR went up to 16, which like looking back, I was like, oh my God, that's really high. I was always worried about her because as soon as she had that heart problem, she was never well again. And she didn't get any support on how to be a well heart patient. And then I was always interested in exercise and I wanted to help her still keep up her walking, but I just didn't really know what to do. And so when I went into nursing, that was the real, I wanted to learn more about, what tablets was she on and what did they mean and how did it work and how could I have helped her better?
Amazing. Gosh, that's such a why. That's amazing. And so I guess what we're going to talk about today is having a chat about sort of the work and the line of work that you do now and having a chat about how that can relate to people who have CHD as well. One of the questions that I see come up, and I think people are a little bit afraid sometimes to start exercising, when people are looking to get started, what do people need to really understand about their heart condition to before they do just dive in?
I think the big thing to find out is if there's any absolute no-nos. And I know it's easy for me to say that, oh, just ask your doctor. First of all, you've got to have access to a doctor, which I know not everyone does because of the pandemic, because sometimes once you're an adult, they sort of cast you off and you may not see anyone for a few years. But if you are able to see a doctor, even if it's once a year, there should be that question around exercise each time to say, is there anything I shouldn't do? Because that's going to vary a lot from person to person. Now, I wouldn't expect a doctor to be an expert in exercise and say you can play tennis but not badminton, but I'd expect that doctor to say any absolute no-nos, like do not get your heart rate above 180 or do not lift extremely heavy weights. There's going to be certain things for each condition that are absolute no-nos. But I guess the other thing is to learn a little bit more about your condition and how it does impact on exercise. So find out a little bit more about how the blood flow works through the heart and what difference it is in your own heart. So has that got an impact on exercise? And it is a bit tricky because every, especially with congenital heart conditions, there's a lot of different ones. And they all mean different things. But yeah, that's the sort of two things, is find out as much as you can from your doctor and also from your own, medical sort of side. So like charities, foundations, any information that's out there already.
And because we sort of touched on it slightly there and you mentioned it, but because it's congenital for our listeners, does that sort of mean the advice might be slightly different to someone who, say, had a heart attack or something, which is maybe cardiovascular disease related?
Yeah, absolutely. Because someone who's had a heart attack may have had some damage to the left ventricle where the heart attack was. They may have had no damage at all. So they may have had a certain type of intervention. Other people may have just had medication. So even within a heart attack, it's very different from person to person. And comparing that to someone who's had, a valve disorder from when they were, born, it's going to be very different. So it's not as clean cut to say, if you've had a heart attack, avoid doing this for 6 weeks and then get back to normal, because it's not as straightforward as that. With the congenital heart defects, it's more what is going on with your heart right now, and finding out if there is anything you need to know about exercise. So do you have an impairment where the blood flow is restricted? Is there a change in your oxygenation? So do we need to be aware of that? You might get breathless earlier because the blood flow is not as good. So it is, it's finding out as much as you can about the condition that you have. And that really helps someone like me to understand. So what I often have to do is then really think about the anatomy and physiology and say, well, how does the blood flow through the heart? How is it different to a normal heart? And what impact will that have? Will it mean someone gets a higher blood pressure because there's more pressure going through the heart? Or will it mean they're going to get dizzy and faint because there's not enough pressure? So yeah, it can be quite complex, which is why I really love what I do, because I can take that time to really research for each person the impact that exercise will have.
Yeah, and it's interesting, isn't it? Because if people do decide to go down the sort of professional route of, I guess, working with maybe a personal trainer, that's sort of the information they need to share with them, isn't it? And what they need to know. Is there any sort of qualifications or experience that we should look for if we are going to go down the professional route?
Look, I guess it depends on how serious your condition is, and if you are sort of up to date with your own body and your own do's and don'ts. So I don't want to scare people off exercise and say they have to have the best personal trainer in the world who knows everything about their condition, because there's not going to be very many out there who do. So if you are armed with the knowledge to say, look, my doctor said I'm not allowed to do heavy weights and I can only work to this heart rate, or I can only do 30 minutes before I know I'm going to get breathless, then that information would really help someone. But in terms of someone who has the knowledge that really understands the heart properly and some of the medications that people may be on, you would be looking for someone who's done the BACPR level 4 cardiac rehab course, which is a level on top of the level 3 personal trainer. So there's a qualification to become a personal trainer, which is level 3, which is the bare minimum. And that person could have 1 day knowledge or 20 years knowledge, but they'd all be called the same thing. And then there's another certification called exercise referral, which is, again, a little bit more advanced. Someone's obviously interested in health conditions. That would be good. That's a good sign if they're already interested in things like blood pressure, medication. And then on top of that, I personally would want someone to be BACPR level 4, which is the British Association of Cardiac Rehabilitation and Prevention. So it is, but it's not, in saying that, you don't necessarily need a personal trainer to be able to exercise.
No, that's true. So let's talk about that a little bit, because we don't want to put barriers in place to exercise. And obviously for some people, access to a personal trainer isn't possible. What are some of the key considerations then for starting out if you want to get into exercise once you've got your doctor's sign off as well?
I think the very first thing is to find something you enjoy, because exercise tends to have this big box put around it where it's like, oh, I couldn't possibly exercise, that's way too hard. I hate spin classes, or I hate going to the gym. I'm worried about people looking at me. I don't know what machine to use. And so I think that's the first thing, is to find something that you're going to enjoy. So it might be a Zumba class, or a boogie around the kitchen, or a bike ride along the canal where you live. So I think that's the number one thing, is finding something that you think you're going to enjoy. Obviously, you might need to try things before you decide whether you like it or not. So that's number one. And the second thing is always set yourself a super low target. So don't have to think like, if you want to go out on your bike, it has to be for an hour. You could literally say, I'm going to cycle to the end of the street and back, and go, wow, I did it. Amazing. Like, I've achieved something. And then the next time, cycle around the block. And then the next time, cycle around 3 blocks, and so on. So set those little really mini targets. And same thing for like dancing. Like, I'm going to dance around the kitchen for 1 song and go, oh, actually, that was quite fun. I might do 2 songs. I might do a half an hour dance class, so breaking it down into smaller chunks, I think, is really important. And then number 3, which is always like my top tip for anyone doing exercise, is to warm up. So warming up is always the most important part. And even if you just do the warm up and then finish, that I would be happy with that.
Yeah, and warm-ups is such an important part, isn't it? I mean, can you maybe tell us a little bit of the science behind that? Like, why does everyone tell us we need to warm up?
So warming up basically prepares your heart for exercise. So at the moment, we're nice and relaxed. We're sitting here. We've got a sort of steady state of our heart rate and our blood pressure. So our arteries are nice and closed up. They're not too tight. They're not too loose. The blood flow to our heart is just nice and steady. And for people who have a heart condition, sometimes that in itself is already a little bit compromised. Okay, so if we then suddenly jump out of our seat and start jumping around or jog out the door, what's going to happen is our heart rate has to suddenly jump from resting up to really hard working really very quickly. And so what happens is those constricted arteries are pumping really hard to get that blood around the body. And it means that your lungs then go, oh, hang on, my heart rate's really high. There must be a really big oxygen demand. So they work really hard, hence why people feel really breathless quite quickly. And two things happen then. Then the oxygen supply and the oxygen demand aren't evened out. So there's too much demand. The legs want loads of oxygen, the arms want loads of oxygen, and the heart and the lungs can't quite keep up with that demand. And then also you run out of energy reserves much quicker. So the heart rate is a lot higher because it's not as prepared to supply the body with oxygen. So it's working harder, which means you run out of steam quicker. So that's the two main reasons. What happens scientifically is the arteries start to dilate. So at the moment, they're slightly constricted. And as our breathing rate goes up, as our muscles demand more, as our adrenaline levels go up a little bit, it signals to the arteries that they need to widen. And those arteries open up, and therefore the blood supply to the heart is much more and much better and much easier for it to get to. And therefore there's more oxygen available. So that's why we like a nice warm up, because it opens the arteries up, better blood flow. And that's in particular really important for someone who may struggle with oxygen demand, may have, valve problem. So the oxygen demand is already a little bit struggling. So it's important for them to do that long warm up in particular.
Brilliant. Yeah, I mean, that makes, a lot of sense. You're preparing your body to get going. It was a brilliant explanation. So talking about sort of warming up, so what is a really simple warm up then that we could do?
It depends on what level you're at. So if you are a very, very super duper beginner, like literally haven't left the couch since March last year, so you're feeling quite unfit, feeling quite scared about exercise, I would start with even just some seated movement. So you could just do some leg lifts, lift your legs up and down. You could do some, arm moves, some boxing. And then to progress from that, you would do the same thing standing. So you could march on the spot. You could do some punches, which is with your arms. And then you could start to move slightly quicker over that first 15 minutes of a warm up. So you could do some knee lifts, and then you could move a little bit faster around the living room. And then you could maybe do some step ups up onto the first step of if you have steps in your house. You could try doing some mini squats and then some bigger squats. So you always start with something slow, something small, and then make that movement bigger.
Yeah, and of course it's important to sort of start small with those movements as well, because you've got to sort of prepare your joints and sort of let them know that you're about to start doing some bigger movements with them as well.
Yeah, exactly. And if you're a little bit fitter, I would say you might be okay to go straight into a walk, but start with the walk before you're going to do anything like a jog, because that is the warm up. So it's very difficult to warm up by jogging. Because what you're doing is going from a resting heart rate of 60 up to 120, 130 quite quickly. And that's still a huge jump, even for someone who's quite fit. So by walking, you're going to build the heart rate up much more gradually, 70, 80, 90, 100, and then maybe go into a super slow jog, and then into a more normal paced jog if you're that little bit fitter.
And what would you say the sort of like time we should set aside for a warm-up should be?
So I'd say a minimum of 15 minutes.
Yeah, Brilliant. So moving on, I guess, just from a warm-up, we've obviously touched on sort of using maybe a fitness professional to help as well if you've got access to that and you're looking to start on your journey. But I also wanted to touch on a sort of another professional area and a speciality of yours, which is cardiac rehab. I guess, first of all, what is that?
So cardiac rehab is usually a 6 to 12 week program offered by a local hospital after a heart event. There is certain criteria to be referred to it, and it is a structured program. It's usually in a group setting, in a hospital setting, but it's a gym, and it builds people back up from scratch again. So you start with very small exercises, and then gradually you get more advanced each week, and they monitor you very closely. And it's brilliant, and it's absolutely fantastic for anyone who has access to it. The criteria is usually for things like heart attacks, like open heart surgery, bypasses, valve surgeries. However, in saying that, sometimes people fall through the net. Sometimes certain surgeries don't qualify. So some people do miss out, which is a real shame, because it is brilliant to have that service.
And I know, it depends obviously on what people's congenital heart defect is, but for some, as an adult, surgery is quite a real prospect, or certainly something that might have to happen in the future, and you don't necessarily know when. And I think one of the things that certainly I hear that is quite daunting is the recovery prospect of that. So I guess, that rehabilitation is really supporting people, in that recovery stage and helping them get back to where they were.
Yeah, definitely. And I think it's really important, if you do get offered it, to go to the cardiac rehab, because it's someone checking in on you. It's someone reassuring you. And so, you can say, oh, this hurts a bit, or that hurts a bit, or this felt really good. Can I do a bit more this week? And I think that's really, really good for someone's confidence to see someone every week, even if it's just for 6 weeks, to start building up that confidence to do a bit more, even if it's just to do their stretches, get the legs moving, all of that. It's so, so key. And then it's not a good idea to compare yourself to others, but I do feel like that group support is really nice. Like, you can go, oh, old Fred's here, he's 97 and he's doing it, like, I'll be okay. I think sometimes that reassures you that you're not the only one going through it, so you're not alone.
Yeah, absolutely. And is it available to people who have never exercised before?
Yes. So, plenty of people who do cardiac rehab have literally never exercised in their life. But again, it's that criteria of, have you had the heart surgery? Have you had something happen where they then refer you to cardiac rehab? So it's definitely something to push for. It's always worth asking the nurses, the doctors, your team, anyone who you talk to, the physios, to say, can I have cardiac rehab? Like, ask a million times. Not every hospital does it. Not every area does it. Not every area has the funding. So sometimes, you fall through the net that way and you miss out, which is why, it's important to maybe try and reach out to someone like me to say, hey, is there anything else I could do? Because I've missed out on cardiac rehab.
Absolutely. And I guess sort of finally, just to sort of wrap up our conversation, with your experience and obviously all your expertise in this area, what's the sort of piece of advice you might offer to somebody who's looking to get into exercise, who has a congenital heart defect?
I think just to get started and do something super duper easy that feels nice, because that's going to make you want to do it again. If I said, right, just jump around the room with a Joe Wicks program, you're probably going to feel awful and it might put you off. And we don't necessarily know if that's the right thing for you. But if you go for a nice little walk and you get home and you feel a bit better and you've had the fresh air and you feel, oh, that felt quite good, you're going to want to do it again. So choose something you're going to enjoy, start out small and just get going.
Brilliant. I love that. I think, doing something you enjoy is one of the key components of making it a habit, isn't it? And doing something you're going to keep up with. And I'm looking at your hula hoop in the background thinking that looks like fun.
It's hard work, actually. Like a minute of the hula hoop gets the heart rate up, surprisingly.
Yeah, good work for the core as well.
Definitely. Yeah, and like I said, ask questions all the time. Every year if you do get to see a doctor, ask them questions. Some doctors know loads, some doctors know nothing about exercise. If you do have things like devices, the electrophysiologists who check devices are the best, to ask about exercise. Constantly asking questions as well. That's another big tip.
Brilliant. Well, thank you so much for joining us today. It's been absolutely brilliant talking to you.
Thank you. Thank you so much for having me. Hopefully talk to you again soon.
Absolutely. Thank you for listening to today's episode. If you've not already, please help us get the word out to fellow CHD'ers by sharing with your network, subscribing to the YouTube channel or podcast series, and leaving your feedback in the comments. You can also stay up to date on all the latest episodes on my Instagram @Hayley.heartfitness.